Good afternoon, everybody. My name is Khadija Patel. I'm an executive vice chairperson of the International Press Institute, and on behalf of the IPI, we welcome you to this afternoon's discussion. We are living in extraordinary times. As journalists, it is the story of our lifetime. And as many of us relish telling this story with the sense of the historical gravity that it presents us, there are also significant challenges, especially for journalists who are not accustomed to covering science. And the thing about the COVID-19 story is that there is a new story every day. It, you know, it, the story itself is mutating just as much as the virus is. How then does journalism keep up? How do journalists, individual journalists, keep up? And that's not even accounting for misinformation that is often being spread by governments themselves. So today, we hope to unpack some of the pertinent issues around the task of reporting on the pandemic. We have with us, a fantastic panel, all of them experienced and ready to talk about their own thoughts and their own experience covering COVID-19 and what their tips, and hopefully we can get them to share more of their tips on how best we continue to cover the story. So again, on behalf of the International Press Institute, welcome. For those of you who don't know, the International Press Institute is actually 70 years old this year. We were meant to have a big bash in New York, and then COVID-19 happened. So we've just we've put the champagne on ice, and we hope to see you all in New York next year. Um, and yeah, so the IPI is a global network of editors, media executives, and leading journalists. And our mission is a simple one. It's to defend media freedom and the free flow of news wherever the flow of news is threatened. And at a time like this, you can understand that the work of the IPI is especially important. For those of you still more curious about the work of the IPI and what the IPI has been doing at this time around the virus, do check out our COVID tracker on the website. From the very beginning of the pandemic, we've been monitoring media freedom violations around the world. And we welcome input from our community as well and from our members. About how they are experiencing media freedom in this atmosphere. So we've already, I think the tracker has now identified over 420 cases of media freedom violations, so to speak, around the world. So that's certainly not a few. That is, it points to a worrying trend and something that we have to be aware of, but also ensure that together around the world that we are building a consensus around fighting, media freedom violations, especially when I think that for me, what the pandemic has done is it assured me that at some level, the public does understand and value good journalism. Um, you speak to journalists and editors around the world, and they'll all tell you that they had record numbers of people visiting their websites, especially at the beginning of the pandemic. And that gives me some heart. It tells me that in a moment of profound crisis, people still look to credible news sources to guide them about what is happening. And this is why media freedom violations are something that we cannot allow to happen. And so we urge all our members and all our friends to join us as we not only monitor media freedom violations but also advocate against them. So again, welcome. We also have more events to come. Today's event is a part of a series of virtual events that the IPI is organizing in the coming months. We are really focused on figuring out, analyzing, and guiding the path that journalism takes as the pandemic develops. So do follow at Global Free Media on Twitter, or sign up for our newsletter to get more information about upcoming events. Now, let's get into today's discussion. It is an especially important discussion, and at the beginning, of the pandemic, I'll just say a little word about who I am. My name is, like I said, Khadija Patel. I'm based in Johannesburg, South Africa, and until a few weeks ago, I was the editor-in-chief of the Mail and Guardian, which is one of South Africa's leading independent news publications. It's a news publication that that has a strong history of investigative journalism, of holding power, to account. But when the pandemic happened, we too were taken by surprise, even though the Mail and Guardian was perhaps one of the first South African publications to start covering the potential impact of the virus here. And for a newsroom without dedicated resources towards covering science or understanding science, or even health or public health, we were found flat-footed because issues like understanding predictive models, and especially early on, and for example, at the MNG, we presented a very, very scary number for which today we still get criticism for. But we try, but it really spoke to the fact that we didn't know exactly what we were doing at that time, right? It was, many journalists like us around the world, were trying to understand and continue to try to understand what's happening. So with me today, I have a fantastic panel of speakers. Dr. Seema Yasmin is a physician, Dr. Seema Yasmin is a physician, a journalist, an author, and a director at the Stanford Health Communication Initiative. She's also a clinical assistant professor at Stanford University's Department of Medicine. With us also is Subra Priya Dashini. She's the chief editor of Nature India in New Delhi. And then we've got Kai Kupferschmidt, who's a science journalist, molecular biologist, and a contributing correspondent at Science Magazine Berlin. So I'm going to ask all of you to forgive me for butchering your names so badly. I promise to try to get it better, perhaps when we next chat. But I want to start off with Seema. There's a deluge of information. Right now, looking at my WhatsApp, my extended family WhatsApp groups, there's a video going around saying that, hey, there's a cure for COVID-19. I haven't watched the video myself, but it's getting lots of people excited, right? How do we as journalists, considering that the science itself is moving quite fast, and is almost moving in a way that it contradicts itself almost constantly, because one study that is hailed today is debunked the next day. How do we actually, as journalists, how do we verify and apply the science and these findings to guide our audience?
Great question. Good morning from California, everyone. Assalamu alaikum, wherever you're joining us from. That's a fantastic question to get us started, because it's one I agonize and kind of almost lose sleep over nearly every day, Khadija, for the last 6 or 7 months, or however long this year has been. It feels like a few decades. I think one of the key things is collaboration. So journalists often, as you said, in newsrooms don't have those resources where there is a dedicated science desk, a dedicated health or medicine desk. And I will tell you just really quickly how my trajectory in journalism builds into that, because I started off as a hospital doctor, then I came to America to serve as an officer in the Epidemic Intelligence Service. So I was just dealing with epidemics every day. And it's when I was doing that work that I realized, wait, every time I get sent to a hot zone, there's more than a virus or a bacteria spreading. There's all this misinformation and disinformation spreading as well. And that's actually what led me to go to journalism school, because I realized, look, journalism is a really integral part of the public health ecosystem. And it's a way that most people get their information about health and medicine and the newest technologies, but it's also where we can let a lot of people down. So I finished journalism school, got hired as a staff writer at a newspaper in Texas, and arrived there just as Ebola arrived in Dallas. I was a reporter at the Dallas Morning News. And the interesting thing is that a very wise editor-in-chief had hired me when other people were like, wait, don't we need another City Hall reporter? We need a cops reporter. Why are you hiring a doctor that just finished journalism school? And it's because of exactly what you've said. Dallas at the time had just lived through its deadliest West Nile virus epidemic. That editor-in-chief knew that there would be more and more health threats. We live in a more connected world. He probably didn't know that during the 2014 to 2016 West African Ebola crisis, that the first imported case of Ebola to the US would be in downtown Dallas. But that's exactly how it played out. And the thinking was that local news especially has been decimated over the last 20 years in the US. And we don't have dedicated science desks anymore. And our readers suffer because of that. So he wanted expertise in the newsroom. I was really grateful to have that opportunity, but also what I learned during that time covering Ebola, Zika, other health threats was that journalism often didn't have that capacity to do it really well. And so at that point, a few years after becoming a reporter, I started doing research on journalism, and I actually started studying the spread of misinformation and disinformation during the Ebola and Zika crises. And as I was interviewing journalists around the world, editors in international news organizations, they would say to me kind of what you just said, Khadija, which is, and I can't credit this to a particular source because it was off the record, but they was really high-ranking editors at different outlets saying, we didn't know what we were doing with Ebola. One of them said we were winging it. We didn't have a plan. And actually, that's exactly how you end up with reporters infected with the very virus that they are trying to cover. So I just wanted to give you that background, especially in terms of my research, because I've been studying this for a few years, thinking about how do we really support journalists to do their job properly. What I learned during the Ebola crisis was the entire newsroom of the Dallas Morning News was mobilized, because this was no longer just a health and science story. It was a cop story. It was a public transportation story. It was an education story. And so you had all hands on deck, rightly so, a few hundred journalists, like more than 200 at the time, all often leaning on me for particular expertise about the virus. And I was thinking at the time, how are other newsrooms handling this? And so I do a lot of trainings now because, again, everybody is mobilized. You know, everyone's Twitter bios read, I used to be a general assignment reporter, and now all I cover is the pandemic, of course, right? And I so want to make sure that my colleagues in newsrooms around the world have the right support, have the right training, have the right resources. Of course, the journalism is extremely critical now. And at the same time, in the US, we've had about 40,000 journalists either laid off or furloughed or had pay cuts right when we need them the most.
Yeah, that's the irony of this time. Fewer journalists when we need them the most. So I'm going to turn to you now. And I think following up from what Seema has just said, the pandemic, if there's a lesson that a journalism lesson that we could take already, is that it's not just a science challenge, but there are various other disciplines also informing how journalists approach COVID-19. Tell me a bit more, what does your experience tell you about this?
Thank you, Khadija, for that question. And I think, yes, and thank you, IPI, for having me here today. To begin with, I would, agree with you that the pandemic is not simply a science challenge. And what Seema just mentioned, we've seen all kinds of reporters coming in to cover the pandemic. So for most of us, I think 2020 will be marked as the year of the great imponderables. We seem to know as much about the new coronavirus and its effects on the human body as much as we don't know about it. So ever since the virus really broke out, what is the most common word that we use in our conversations, our emails, our news reportage? It's uncertainty. So while, as you know, I work with a peer-reviewed organization where Nature, is one of the flagships of the nature research organization. So I work with Nature India, which is not peer-reviewed, but the peer-reviewed part also I see very closely during my day work. And so while submissions to peer-reviewed journals have really gone crazy, and preprints are published at a never before rate, it always is a challenge to keep up with that kind of information coming in. So how really does one cover the evolving science in a pandemic? And Seema has just mentioned how people are leaning over her for all kinds of information. And as you can imagine, this has been the science journalists' moment under the sun, if you will. And for journalists from most other beats, political, economic, transport, even sports journalists I know have been handling science pieces in resource poor newsrooms. So, what better a time than this to reinforce the need for trained science journalists in our newsrooms? So, let me begin by giving you a very quick overview of how we at Nature India, in specific, and at Nature broadly, follow and report the rapidly evolving science. How do we decide which bits of science to report, and more importantly, which not to? So, quite early in the pandemic, we quickly drew up our editorial criteria to try to help filter ideas and distinguish our coverage. So, we wanted stories or coverage that met the following criteria. One was whether it's an essential story, it adds value or offers an original angle, which means that we might well leave a scientific paper or a story that every other news outlet can cover, as we can't add much or be as fast as any other newsroom, probably. By essential, I mean it must also be focused on research and researchers. So that's our mandate, really, to cover science in its entirety. It also should offer the authority and depth on a key issue about the pandemic. So that's one thing we look for, essential. The second thing we saw in a news story was whether it was desirable. So is it international in its scope, or is it just talking about one small region, or some area that may not be of larger impact? Is it show why the issue matters internationally, really? It should also then include data, very essential to be the backbone of the story. For whatever we are saying, whatever narrative we are weaving, it should have a backbone of data. So a general policy, again, on covering preprints, which is a big issue now, and we've seen a huge number of preprints during the COVID-19 crisis. We do report on them, but our policy is always to say that it has not been peer reviewed. And in a news story, to try and seek comments from other experts in the field whenever we are covering a preprint. What were the key challenges we faced or continue to face?
I think we'll come back to that one there.
Okay.
If you could just hang on to that one there.
Yeah.
I'm going to move on to Kai. Kai, Sibra's done a fantastic job of saying, and outlining how her publication actually goes about citing the new values speak, of evolving science. Tell me a little bit more. How do you choose what to focus on? There's a deluge of information. So how do you exactly choose this is the story that needs to be told? How do you flesh out what exactly is important?
Yeah, thanks for having me, first of all, and thanks for the question. It's this is a really complicated one. It's evolved a little bit over the course of this pandemic, I would say. So, maybe my situation is a little bit different from any other journalists in the sense that, I was kind of on the pandemic beat before there was a pandemic. I guess I've been reporting on infectious diseases kind of globally for 10 years almost. And so we jumped on the story fairly early on. So I wrote my first story, I think, on the 9th of January. And at that point, of course, you were basically just looking, for the basic information, what's happening. there was a new virus, that much seemed clear, and there was this issue of, was the genetic sequence being shared? What were people knowing? Was the human-to-human transmission? So in the beginning, as this grew, that seemed quite clear. And certainly, to me, it feels a little bit like when you look at that curve of the epi curve of the whole pandemic. I mean, when you're in the middle of it, it already seems like it's very big, but then, now looking back, it was quite small then. So there was a phase in March, I think, when already the information became so dense that it was impossible to do it. And I'm very lucky. I have colleagues at Science, John Cohen, Martin Enserink, and others who, so we can kind of divide up the stories and then kind of make sure that we try to cover certain parts of it. These days, even like if you said, just COVID-19 vaccines, it is such a huge field. I mean, there's, I think, 200 candidates now. You have at least 4, I think, in phase 3 trials. And so, talk about equitable distribution of the vaccine, that in itself, is an incredibly complex topic. So what I try to do now is, first of all, I try not to go back behind stories I've done. So there's kind of a danger if you take hydroxychloroquine, I think the study that the UK recovery trial did, that's the best evidence we have. And there is a kind of sense sometimes in journalism, of course, we report the news, right? We report what's new. But in science, stuff can come along and it's new, but it doesn't tell you anything that's actually new, because the older study was better done in more patients to a higher standard. So it doesn't really make sense to, report on something, even if it seems new. And I wish this is something I really wish people would take more to heart, because you end up kind of, dissolving your own journalism, kind of, even if you did a really good job of covering the recovery trial, and then you take some bad, small study to say, oh, maybe it works after all, you're kind of, first of all, losing trust with your readers, I think, but also, you don't have to do that. So I kind of, now I try to look at the broader field and I try to understand what really stands out. I think it's hard in this situation because things are happening so fast as well. But I think you need to take time, like in certain areas, at least, you need to kind of get a sense of what is really new in this field. Like, so at the moment, mostly I'm covering experimental treatments and kind of the genetics, the mutations, and then the epidemiology. Now, in all of these fields, I kind of tend to do a story and then, look at what has happened in the 3 weeks before that I think is really important. And then I move on to the next topic and then I revisit it afterwards. It's not ideal, but in the current situation, you really have to be willing to not report certain things. I think it's that's kind of not the normal situation for us as journalists, but in this situation, you just have to realize that there's so much going on that one of the main jobs that you have as a journalist is to find out what the information is that is high quality information that you need to get to your readers or listeners or viewers.
So I'm going to end there. You're saying that we obviously need to prioritize high quality information and obviously go through a process of understanding what is valuable for our audiences. But we're seeing increasingly that people only want to engage with stories that reinforce their own worldview. How then do you reach these people who are polarized, locked into their own filter bubbles? How do you get through?
Yes, I don't have a good answer to that. Like, a lot of this depends on trust and building up trust. And I realize now, I'm on Twitter a lot more than I used to be. And you kind of see certain mechanisms, and certainly something, there's a sense, and sometimes, if people don't understand certain things, you can sometimes, sometimes people react very harshly, calling people COVIDiots and things like that. And I think, sometimes people are just trying to rile you up in a sense. They're not engaging in a good faith effort to have a conversation, but there are enough people that I think we can reach if we do a good job. So at least at the moment, because I think there are structural issues here, if we talk about social media, if we talk about the way that our media ecosystem is shaped, there are structural issues that we won't be able to solve in the middle of this pandemic. So I'm just trying for now to concentrate on those people who are in the middle. It's similar to when we talk about vaccine skeptics. There's a large part of that is really people who are on the fence and who are open to arguments. There are hardcore deniers that are, hard to reach. But I think for now, we kind of just have to realize that there are still people that we're reaching that are open. And if we do our jobs really well, and if we explain things really well, and if we take them along on this journey and always kind of have the caveats there to make sure that people understand, the state of the science can change, if we write next week that this is different than we thought, that doesn't mean that the story was nonsense. I think we need to just kind of like do these things, which sometimes, at least in other parts of journalism, haven't played such a big role, because the tendency has been to kind of like, amplify certain things and make them stand out starker. And here we really have to do the opposite. It's all about context and caveats. But I think if we do that well, we still reach a lot of people. I really hope that, and I believe it.
Seema, you have some thoughts.
I have so many thoughts on this, Khadija, because it's exactly what I study. And it also, I come to it from a very personal perspective. So I actually have a book coming out in a few months called Viral BS, Medical Myths and Why We Fall for Them, which I started writing years ago, long before a pandemic. And the book actually starts with a personal story about how I grew up as a British Muslim in an immigrant Indian family, growing up with conspiracy theories, because that's not unusual for many people of my background. And now, as someone who is a disinformation scholar, I do this work for a living all day. I train journalists and I train physicians as well on how to talk to patients who are vaccine hesitant or vaccine skeptical. And yet every morning, it happened again this morning, I wake up to messages in my family group chat, which are conspiracy theory videos. And I'm like telling my aunties, these aren't even good ones. You're not even sharing the sophisticated ones. This is so bad. This is a really bad fake, auntie. So I have to deal with that every single day.
Tell us, was it the 5G towers? Was that it?
That was a few months ago, Khadija. Today it's a whole nother theory. It's awful. And the interesting thing is, often as an emotional human being, I do all the things that I tell people not to do. So when I'm training physicians, for example, and I'm going through all these steps, because there is evidence on how to talk with people, on how to counter false narratives, on how to engage with folks who have very polarized beliefs about things. And of course, when I'm in the group chat, I'm just like, can everyone stop? Can you just take a second? Can you just, and actually that just kills the conversation. It doesn't help anyone. But what I wanted to say was there's a lot of evidence now about how to counter these situations where you have very, very polarized beliefs. Of course, I've been studying the anti-vaccine movement for a while now. We're talking about that, but also anti-masking groups. Again, nothing new. We saw anti-mask leagues 101 years ago during the Spanish flu pandemic. But what we've studied and what we've seen over and over again is that sprinkling facts into a conversation that's very polarized is like pouring kerosene onto a fire. And it's really important that we keep reiterating this, because especially in my world of public health and science, we feel really good about ourselves, that we are armed with the evidence, we have the facts. And for years, I've been trying to talk to my peers to say, look, there's all this evidence in social psychology and in the comms field that if you just add facts to it, it doesn't help. You really have to go back to some basic, finding some common ground, understanding where people's beliefs are coming from, and being really understanding of the fact that you can't just say, well, there was lots of anti-vaccine messaging happening in this region. We went and we disseminated leaflets, which is what many public health organizations will do, and it's not sufficient. So I just wanted to share that because we often do feel like, well, we can just counter the falsehoods with the accurate information, and time again, we've seen that that doesn't work. With those studies that we've seen about how false news travels faster and farther than accurate information, when we've done the digging to understand why that might be, it's because the falsehoods are often packaged in these really compelling, entertaining narratives that trigger emotions, that are quite sensationalist. And that is stickier, more memorable, more shareable, as evidenced by my family group chat, than the accurate information, which is no, hydroxychloroquine does not work, or yes, vaccines are safe. And so even though this is a very challenging area, we're going to have to keep that front of our minds.
If I can jump in just for a second, I just wanted to say, like, so for me as a journalist, one of the questions where this comes up is when we decide, so when do we actually cover a conspiracy theory, right? And that's like one of these issues where you're really, because of course you're amplifying it to a certain extent. And you do have, psychological evidence that suggests that sometimes if you're just, if you're debunking it and you're doing it in a bad way, you're actually just going to end up spreading that. So there's a very high level of responsibility on that particular topic. And I would always, kind of encourage every journalist to really think about these, just to, first of all, just have this flag in your mind when you're going to write about a conspiracy theory or something that, is bogus. Really think about, why are you doing it? How are you going to frame it? We do know the kind of truth sandwich where you kind of say, this is the fact. I mean, even if you kind of write a headline and it basically includes the wrong fact, but you highlight it in a certain way, that can just, a lot of people won't read the article, or they, the memory kind of plays tricks on you as well. It's really tricky. So this is something, it's not something to just do as a side project because you think it's fun. I think these are, core issues where like Seema said, and Seema, that there is evidence on this. I mean, there are, best practices, and it is worth looking this up and talking to people before you do that, I think.
Absolutely, and there is evidence, as you just said, Kai, that when you debunk a myth, even if you're repeating the myth to in a really good and credible way, debunk it, you're just giving it more oxygen, you're giving it a platform. But then, of course, there's also that evidence that shows it can be really useful to many people. When you go into detail, you're telling them, look, this is why it's wrong, but it can be complicated and we have to be really, really careful. And the semantics of it is also very important.
I think one thing, just from my personal experience, one thing that I took away when I was writing about vaccine skeptics was really this idea that like the human mind abhors a vacuum in a way, right? If you just take away someone's beliefs, that is really, really hard. But if you kind of counter it with a very clear different narrative, so if you take Wakefield, for instance, if you tell just the story of how Wakefield did his research and what his conflicts of interests were, and if you explain the motivation for him, for what actually drove him to do this, that is something that sticks in people's minds because it explains to them both where that belief came from that they used to have, and it replaces it with something else. You can't always do that on the fly. It's hard work to do this well, but it is kind of the gold standard to me.
And it's useful that you mentioned the word vacuum, because that's actually where the conspiracy theories do a really good job, in that the human brain loves a complete story. And we live in an uncertain world. And it's so frustrating to me that as scientists, we will say a thing and then we'll be like, here are 10 caveats as to why I might be wrong and why there's uncertainty. Whereas you'll have the governor of Florida, DeSantis, say, children are not vectors for this virus. And they'll say it with such certainty that it's completely believable to many, many people. And it helps plug those really annoying vacuums where there's just knowledge gaps, which science will fill, but we will take a long time doing many good studies to fill that vacuum.
Yeah, so one thing I think, yes, sorry, Khadija,
Go
can
ahead,
I come?
go ahead, go ahead.
Yeah. Yeah, I was just trying to say to all of this, the conspiracy theories, the bubbles, the vacuum. I think one thing that we have learned in this last 6 months at least, and earlier during Ebola as well, is that, working with public engagement people as journalists, if we are working with people who are doing public engagement of science, that really adds another layer to what we do on a daily basis to earn our bread. We can go do a great story on vaccines, on masks, or hydroxychloroquine, and then we publish that story, we put it on social media, and that's how much we can go, really, to spread the word about that story or to counter something. But if we really want to go beyond that level of engagement with one particular story, we have discovered, and I do this, like Seema said, I also engage a lot with public engagement people now as a editor and a journalist, and I take it very personally when my story is not reaching. And India is a huge country. We love our demographics, right? So so if it isn't reaching a huge number of people, the message, then I somewhere feel as a journalist my duty has not reached its logical consequence. So I'm working with a group of mythbusters as well as a group of fact checkers and a group at Google News Initiative to not just train journalists to make a better medical reportage, but also to see how we can disseminate these stories better by engaging with people who are there at the grassroots, who are going from village to village to spread messages. So to talk about the rigors of science, like Kai also mentioned, about the uncertainty of science, about what's true today may not be true tomorrow, but why that truth today matters, and why what isn't true tomorrow also matters. So how science evolves, how medicine evolves, all of this is not public domain knowledge. It really needs to go down to those levels. And so working, if we can work as journalists, I mean, I am very passionate about doing this. And so I know a bunch of other journalists who do this around the world. I mean, we are really hard up with our time to dedicate to these things, but I think it is a thing worth doing if we want to see our stories really revel in their numbers.
I think that audience engagement part is really key when you think about disenfranchised and marginalized groups, and also how difficult it is to have this conversation about journalism without thinking about the relationship between some communities and journalism, and how some communities have been really poorly served over the decades, and how that builds into a lack of trust of the fourth estate. And also looking at how not diverse newsrooms are. I'm speaking from my experience in the US, but I think it might be reflected in many ways in other parts of the world, that when it comes to story selection, when it comes to our roles as gatekeepers of information, we have to always think about our lens of the world, our perspective, what perspectives we're bringing. And oftentimes the stories that get trashed are the ones that might affect the most marginalized people. And I think it's important for us to keep thinking about our audiences. And especially one of the things I study is the overlap of medical deserts and news deserts. And I think medical deserts are a well understood phenomenon. You know, so many parts of the US where people live and just don't have access to good medical care. But then you have news deserts where local news has been decimated. People don't have good accountability journalism. And you think about the people who, it's often people of color, it's often African-American people who live in those places where they are subject to both a medical desert and a news desert, and are then doubly vulnerable to both disease and disinformation about disease.
Following up from what Seema has said, I think our conversation has made it clear that this is not an easy topic. Then covering COVID-19 and the evolving science is technical. It requires particular experience, particular know-how, and access as well, to the right information. But we're living at a time in which around the world newsrooms are shrinking. Seema also mentioned, the way, the local news issue in the US, where hundreds of newsrooms being shut down just the last 18 months, and for us in the global south, it's quite similar, right? We haven't yet been able to pivot to the right business model, and with that comes the consequence of smaller newsrooms. And yet this is the story of our lives. So how have you seen newsrooms actually deal with the, with these challenges?
You want me to answer that?
Yes.
Okay. So while we are a specialized newsroom, a science newsroom, I have had my stint with most of the leading news media organizations in the country, and so I can tell you about what happens there. And as you said, in the global south, there have been hundreds and hundreds of layoffs in newsrooms. So especially in India, we've seen more than 500 people losing their jobs in the media industry during the COVID-19 pandemic. So the challenges that I see here during the pandemic is, number one, the amount of protection that journalists get while going out to cover, in the field, the pandemic itself, the socioeconomic impacts, the generally the people who are suffering into the medical world, into the hospitals, wherever they're going, I don't see people really having the protection they deserve or they must have, in terms of uh, uh, protective equipment as well as job protection. So the moment somebody becomes COVID-19 and they come back and report it to their bosses or to the news organization, they're actually asked not to come into the office. And rightly so, but very soon a letter of, asking them to resign from the job also follows, which is not something that you would want to do. I mean, it's almost like the HIV case repeating itself now. So during the HIV, AIDS regime, we saw that lots of journalists were also, asked to, not just journalists, across the workforce, people were asked not to continue in their services to the companies that they were serving at that point of time. So that is one really big issue for journalists. The other one, of course, we've talked at length about the evolving science and why that doesn't make sense. The speed at which the pandemic is changing, the story and the science were changing very quickly at the start, and the papers continued to flood out with those stories, which also gave rise to the question of what happens to other stories during a pandemic, in the newsrooms. There are equally important stories happening, as if the newspapers have existed for millions, hundreds of years, and so they were covering other stories. What happened to those stories suddenly? So that's another challenge that newsrooms are facing now, about prioritizing COVID-19 over everything else.
That's such a great point, Subra. I was just thinking that when what you're saying, it's not like gender violence or gun violence or anti-vaccine movements at large or government corruption has gone away during a pandemic, but we just have fewer resources to try and cover absolutely everything.
Absolutely. And all of a sudden, we've all shifted to working from home, or working at home, or working for home at the same time, with children, or caring responsibilities and stress. And one thing that is not talked about much is the mental health of journalists and editors who are dealing with this deluge day in and day out. And that, I think, is the least talked about and merits a lot more mention in our conversation.
Absolutely.
I actually have a question for you, because there's two things that Subra mentioned that are so important. One is the journalists who test positive for COVID being told, sorry, you no longer have a job. And second, that the issue of the mental health impact on journalists covering this pandemic. And I wondered if those are issues that IPI gets involved with, and if so, how it might support journalists in those situations.
So I don't have a ready answer for you. I think that our response to the crisis is also evolving. And this is one of the reasons why we're having these discussions, to better match our own response to the needs on the ground, so to speak. So we're happy, to speak to you and to speak to others to actually, to establish interventions that make sense. This is unprecedented, and we are constantly trying to understand how best we support journalists around the world, supplement the work, and clear the way for information to be shared. So certainly, if one of the outcomes of today's conversation is a tangible outcome or project for the IPI, we'd be very, very pleased to that. So, on the topic of, the challenges of working from home, I have my niece who have been sitting and been at my door for the last 15 minutes saying, open, open, open. She's 1 year old. So certainly an interesting time for all of us. She can't understand why I don't want her in here. But we've got loads of questions, I think, coming in. And I would like to encourage everyone else who's watching to send through your questions. We've got a fantastic question for Kai here from Sunny Krishnan, who's, first of all, a fan of your work and has been following your work on Twitter. I'm not sure if you've actually read Sunny's question, but if I can tell you, so in South Africa, where I'm based, the Times is South Africa's biggest newspaper, or at least the biggest traditional source of news, ran a headline a few weeks ago, on the stage of South Africa's lockdown, basically saying "end the lockdown!" exclamation mark, right? A very brave editorial move, but basically calling for the lockdown to end. There's a particular context in South Africa in that, the lockdown has had harsh economic consequences. But then on top of that, we've now also, we're dealing with a pandemic that seems to be running away from us right now. So there's a lot of questions now, and some soul searching being done among journalists here about what's the right balance for us as journalists, trying to straddle the path of, of yes, we need to save lives, and a lockdown seems to be the easiest way to do that. But at the same time, there are economic consequences. People are going hungry. South Africa is staring at a 50% unemployment rate by the end of this year. That's quite intense. My brother lives in Malawi, and he tells me that he's speaking to some of the vendors in his street, and asking during their lockdown, so why haven't you gone back to the village? And I think the Ghana vendor told him something like, I die from starvation or I die from the virus, so I've got to choose which one. But and that's and that is the unfortunate truth, for places where many of us come from, like in most of Africa. So what then is the role of journalists there? And I think that's basically what Sunny's asking as well. Kai, do you have any thoughts there?
Well, I think so. First of all, I think it's really important what you say, just to acknowledge that reality. I think, this sometimes gets lost because journalism can be very kind of opinionated, or it's driven sometimes, especially like when I watch the US kind of stuff, it's, one person with one opinion, one person with another opinion. I think our job as a journalist to a large extent is to just explain the trade-off here. I mean, there is clearly a dilemma, and that dilemma plays out differently in different parts of the world, but certainly we have the same discussion in Germany about, do we wreck our economy or do we let people die, basically. I think that's a false dichotomy. If you really look at it, it is very clear that if you have a out of control pandemic, your economy also isn't going to look rosy. So I think there's a lot that you can do just to explain it, but still there is a dilemma. The dilemma is that in order to stop this pandemic, you are depriving people of their livelihoods, you're depriving people of their freedom to a large extent, you're depriving people of fun and the things that they want to do, the things that we enjoy in life. So this is not an easy question. It's not, it's not something that you can wave away. And I think you just have to, make sure that you take that into account, and that you, that you do talk to people also about what this means for them. But then also, on the other hand, there's a lot of really good epidemiologists who've been very, very good at explaining this. And we had the situation in the US where you had the protests after the George Floyd murder. We had the protests of, people against police brutality against Blacks. And a lot of epidemiologists said, look, there's clearly a trade-off here. I mean, if thousands of people go on the street, there's a danger that the virus will spread, but still, this is also a public health problem, and police brutality, especially in the US, is a public health problem. So it's always a trade-off, and it's our job to explain that, not to take one side, not to say, but to really explain that. And you will see that if you talk to a lot of people, a lot of very smart people, who thought a lot about this, will give you a lot of, very, very good thinking about why, in the end, a lot of these restrictions are necessary, as hard as they are. But we're all trying to thread the needle here. I think, it's also, what I try to do a lot is also to just look at other countries, because I think we've really, in the beginning of this pandemic, we did really badly at seeing what was happening in China. And, I'm convinced that there was a certain, racism in the way that people were looking at China and thinking, oh, yeah, it's China, they're not getting this under control. Now we have the US with this, insane epidemic happening. So I think looking at other countries and also explaining, look, they made these choices, and you can see how that also doesn't really work very well, right? In Europe, everybody was looking at Sweden and say, you know, you can argue that Sweden wasn't as bad as some people thought it would be, but economically, it looks just as bad as everyone else. And in terms of health outcomes, it looks worse than its neighbors. So, you know, there are certain things that, like, you know, if you're a good journalist, I think you have to start with an honest question. And I think there is an honest question here that is, how do we find the right balance between these two, you know, things that are both really important? And if you do that, you're going to find yourself on a journey where you look at other places, you talk to experts, and you kind of like get different, you know, different pieces of the puzzle. And then you have to try and take your reader along and explain that and kind of show also, you know, what picture emerges from that puzzle. It's not going to be perfect. And this is a dynamic situation, and, you know, it's going to be a different balance in a few months. But if you look at Europe, it's quite interesting that there's, I mean, the Oxford University group, one of the Oxford University groups, is tracking how strict regulations are in different countries. And you can see how, like, Sweden started with almost none and then slowly ramped up. Germany went all the way up and then slowly went down. But now everybody's roughly at the same level of restrictions. So there seems to be a kind of balance, you know, at least when you have the situation that you currently have in Europe. That balance is really, you know, fragile, and it'll shift again. But people are coming to kind of similar conclusions. So I think you have to start with an honest question and then be led by the data as much as you can. I think that would be mine. And don't get distracted by, you know, old white men who have, you know, a lot of experience in some completely other field and are totally convinced that they know the answer. Because I've seen a lot of that journalism too, and it's amongst the worst that I've read in this pandemic.
And I think if there's one piece of information that I would share with journalists who are watching, it's to be so careful, so thorough, and completely vet your sources, because all of a sudden we're flooded with just the kinds of sources that Kai is talking about, who have expertise in a particular area. It doesn't necessarily apply to viral epidemiology. We've also seen the same with lots of economists giving blanket statements about contact tracing not being useful. And you're kind of like, okay, you have a Nobel Prize in economics, but you're not being accurate in talking about the role of contact tracing. I just want to add one other thing to what Kai added. I think that absolutely there's pitting the economy against public health keeps being done. I think it can be quite satisfying to some people. It's like this one entity versus this other entity. It's absolutely a false dichotomy. And so the role of journalists is to then keep connecting the dots, to keep reminding people how the two are really interconnected. And as well as comparing one country's response to another country's, I think you can also look at history, where we saw with the 1918 Spanish flu pandemic that reopening a country, reopening an economy, only to have to close it down again, and then reopen again and then close again, was actually much more detrimental to economies versus a harsher, longer lockdown with gradual easing. And I say that we should do that. We should look at historical examples, also understanding and knowing that we seem to ignore a lot of the lessons that history teaches us and we're just repeating them. But I do think it bears connecting those dots and reminding people of the historical precedents.
Sabra, do you have any thoughts on this question?
Yeah, I think one way to look around this honest question and the dilemma is regional variations in what has happened. And Kai and Seema also mentioned about that. What has one country done that has worked for it, or one region, like we saw in India, Kerala, the state, had a wonderful model in the beginning, and they did fantastic. Now Kerala is again back in chaos. So something that worked at one point of time doesn't work at another point of time even in one small region. So to pull out those examples and to create this sort of kaleidoscope of examples of what works where, what did not work where, and whether there's as Seema mentioned, there's a story in history that we can fall back upon and see, and whether the instance of history that we are falling back upon actually had the similar set of variables that we're talking about today. Was it as dense during the Spanish flu, for example? Ask those honest questions. And so probably to give the audiences or our readers the idea about what works where would make more sense, even in terms of intervention. You know, when we're talking about, see, this country has everybody masked up, and therefore the number of cases is less compared to where you sit and where you don't wear masks. So these stories are not just about epidemiology or regional variations, but also about correcting public interventions, you know, medical or non-medical interventions, and making people aware also of the fact that these decisions are not just taken by governments arbitrarily. There are administrations and governments which are taking these decisions based on these scientific or whatever political or economic data, you know, that is emerging. So making people aware about the emerging data as on today is also something that works.
So we're almost out of time. So I'm going to start wrapping up, and I'm going to put my panelists on the spot here and ask them very, very briefly to tell us, where is the story going now, in your opinion? In which direction do you think the COVID-19 story should be going? Where should journalists be devoting their attention right now? Shall we start with you, Seema?
Sure. I think we need a real focus on marginalized communities and how this pandemic is a global pandemic, but actually it's epidemics within epidemics and playing out really differently in different communities and having a very disproportionate impact on people of color, marginalized people, and also asking questions about how that epidemiology might be affecting the pandemic response. I think that's an important question for journalists to be asking.
Kai?
So honestly, my best guess at the moment is that, the vaccines are really coming into focus because we do have phase 3 trials. And as they do, I think, given what Seema just said, it is a pandemic. The topic of equitable distribution across the globe, the question of who bought what vaccine at what point, whether the COVAX facility that the WHO and Gavi and CEPI have done, will get off the ground. Those questions will loom really large, and they will loom even larger because as many countries get into a second phase, possibly, that's the other thing that's kind of overlaying the vaccine question is, do we get a flu season in the Northern Hemisphere? Are we kind of tired and the virus is coming back anyway? So all of the public messaging is going to be a little bit like, okay, you just need to, sit tight for another, 3 months, 6 months, what is it? So that question is going to be really important. And that's where the equitable distribution plays a role, because every government wants to be able to tell its citizens, just hang tight for 3 months and then it's over. And on top of that, of course, you have the whole scientific uncertainty about, whether the vaccines work, which ones will work, and when they will be ready, and the manufacturing. So I think, the world is in, if we had epidemiology 101 in the last 6 months, I think we're getting vaccine manufacturing and vaccine production 101 in the next 6 months, I think.
Thanks very much, Kai. And you, Subra?
Yes, I think vaccine is one of the key questions, how it will respond in various people. Apart from that, some of the science questions that are yet to be answered are one of them is, why do people respond so differently to COVID-19? That scientists are still working on these questions. What's the nature of immunity and how long does it last from person to person? That's another question that we are asking. Has the virus developed any worrying mutations? Though largely we know none, but yet that question is being asked by scientists. How well will the vaccine work above all? And what is the origin of the vaccine, of the virus, sorry. So that question is still an enigma. And so when I started, I said we're living in the world of imponderables in the last 6 months. So 6 months, I think, is very less in terms of science and scientists who are working on these questions. So going forward, I think science journalists or journalists in particular from any country would have these questions on their radar as well.
Thank you so much to all of you. I'm pretty sure I speak for everybody who's listened in and who's been watching both on Zoom as well as on YouTube that this has been a fantastic conversation. You really are an impressive bunch of people, and well done on the work that you're doing. And thank you for sharing so much of yourselves and of your knowledge with us. And hopefully, we can actually also take, some part of this discussion and have that guide an IPI initiative in the coming days and weeks. So thank you all on behalf of the IPI. Thank you all, and keep doing what you're doing. We need all of you. And we thank you for the work that you're doing. And for everybody watching, listening in, thank you for joining us. And remember to check out, IPI on Twitter, as well as its newsletter for other events. Meanwhile, everyone keep safe, and thank you very much.
Thank you. Bye, everyone.
Bye.